Another issue that can cause back pain is actually having hamstrings that are overly tight. So we have to be able to, a healthy hamstring, I should say, is when you can extend your leg at a 90-degree angle and go all the way straight. There's very few people who can do that, all right? So that means sitting up in a neutral or an optimal spine and extending the leg all the way out without having to rock back off your sits bones. So having a hamstring that's long enough to be able to do that will show that you can actually sit up in neutral without gripping or holding yourself up with your hamstrings. That's another problem that will happen. Again, if you have those hamstrings that are short and it doesn't allow you to sit up, you might want to elevate yourself so that you don't have so much pressure on your hamstrings, tucking your pelvis under and putting all that pressure on your lower back. One of the biggest problems that we're seeing, especially right now, is just atrophy. So that means your muscles not being very strong. If you don't use them, you've heard the phrase, use it or lose it. This goes with our muscles. If you're not constantly, actively using your muscles, they start to deteriorate and become less and less strong. You have to use your muscles in order for them to stay strong. So by sitting and not moving even much to go to the grocery store or walk outside, your whole body starts to atrophy. That's going to happen in all of the joints. A huge brunt of the blow is going to go on your lower back, because what happens is then you go and you try to pick up something heavy that you used to be able to do a year ago or 9 months ago, and you try and pick that same thing up now, and you don't have the support of your deep stabilizing muscles in your lower back to actually maintain that load. And this is one of the ways that people will blow out their back or give themselves a herniated or a bulging disc, is trying to do something that their body is no longer strong enough to be able to do. The other thing I need to mention is our abdominal muscles. So I spoke of the deep stabilizing muscles of our spine, but our deep abdominal muscles, our fancy transversus abdominis, you've heard me talk about this, that actually connects to the vertebrae in our lower back. And I don't know if you can see on Herman, but it connects all the way around to the back part, wraps around, and comes to the front into a linea alba, which is a ligament that connects here. It's a huge muscle, and it connects from the back vertebrae, circles around, and comes all the way to the front. And it also connects into our pelvis. This muscle is crucial to be able to stabilize your lower back. And it's activated by breath, all right? So that is why every single lesson that you've ever seen me start with, we start with breathing, all right? And every single movement that I talk you through, there's a breathing pattern, because we want to chronically activate that muscle so that we're strong. And this is one of those muscles that if you're not activating it, it gets weaker, weaker, weaker. So sitting at the computer with a very shallow breath, putting excess pressure on your lower back and not breathing properly, you're going to end up with back problems. There's no way around it. Another thing that will happen is we have excess weight. So when we have extra weight on our body, especially if we gain it quickly or we gain it and we're not moving and we're in the process of gaining it, we can't handle the load. So just having extra visceral fat or fat around our waist that we don't necessarily need to have puts extra pressure, because you have to carry that weight around, and it is very heavy. This can also happen by overbuilding your muscles. So I've had several clients now that have had overbuilt shoulders and overbuilt arms and biceps from weightlifting and that type of thing, and they end up with lower back pain because their muscles in their arms aren't balanced to the amount of strength they have in their torso, and then they're moving things around and they blow their back out or give themselves a herniated disc. simply because their arms are stronger than what the strength of their center can handle. So it can be extra weight from excess fat, but it can also be extra weight from excess muscle and having to bring all that weight around, putting all that pressure on your back that can cause part of the problem. It's all about balance. Like we talked about in our last lesson, there's collagen disorders. So that is the autoimmune component to this. And this is when something goes wrong in our body and our immune system will start to attack our tissues. So our immune system can start to attack the muscles, the ligaments, the joints. There'll be inflammation in the joints because our body is trying to heal whatever is going on. And the integrity of the joints start to break down, and this can happen in our back. And one of the things that can happen is arthritis will form, and you'll have little bone spurs at different points in your back, or you'll just have the breakdown of the cartilage or the breakdown of the disc because of this autoimmune process, which I like to lump together as collagen disorders. And then you'll have pain in there because of that. And so we can do exercise to help support those things, but you need to go in and deal with all of the other components of diet and lifestyle, diet, rest, exercise, stress reduction, dealing with any sort of hidden toxicities, internal, external stress. All of those types of things need to be taken care of to alleviate that inflammation. When that inflammation is down, then you can go back in and really start to strengthen things and get yourself back in order with all these fabulous exercises that we're going to learn about shortly. One thing we have to remember when we're dealing with our lower back is that everyone is different. So when I'm teaching optimal spine or optimal breathing, that is per each person. So I can give you guides as to what might be the best alignment for your body, but really it is very individual. So when I say neutral spine or optimal spine and teach you how to line yourself up, it's actually different for each person. So that's where, if you're confused with that, having someone cue you through that to find it is extremely important and can be very valuable. The other thing you have to remember is you're not going to look like someone else. Let's say you're taking a class or trying to compare yourself to me. You're just not going to look like me. I have a totally different body than you. You may be in a situation where your neutral spine is a little more flat than my neutral spine, or your neutral spine is a little more extended than my neutral spine. The key is to not be in pain. If you put yourself in a position with your back, or your body for that matter, and you have pain, that's not the right place for you. And you have to find the balance of what a neutral, safe, and comfortable place is for you, and then fortify that with your strength, as well as with your flexibility in that area. Lastly, I want to mention that the problem may not actually be in your lower back. And this is the thing that people forget about all the time. The pain may be in your lower back, but there may be another part of your body that is being improperly moved, or it's weak, or it's overly stretched, or it's overly strong, that is creating tension and moving the bones out of place to where you're having pain. So like I said about overbuilding your shoulders and then not having that strength to be able to maintain, that can be one of the problems. But if you have a misalignment in one of your shoulders or a misuse of one of your shoulders or your arms, that can throw your whole body off, and you may not feel the pain there. You may actually feel the pain in your lower back. It can be coming from all the way down in your foot, through your knee, all the way up into the hip. You don't necessarily have pain in the leg, but your breaking point is in your lower back. And so to alleviate that pain, you gotta adjust the whole body at the same time while bringing that strength and awareness to your center. And this can be one of the most tricky things, is figuring out, who came first, the chicken or the egg. and which part of the body is actually the one that's creating the pull or the tension that's putting the pain in the lower back area. So you have to look at yourself as a whole person and not only focus on where the pain is, but you have to look at the movement patterns and the alignment of the whole body and adjust the whole body and all of the movement patterns to alleviate some of this pain.